All right, welcome back, everybody. You want to take your seats? And we're headed into our final presenter of the day. And this presentation is sponsored by the Daily Racing Form. Daily Racing Form is the thoroughbred enthusiast go-to for past performances, closer looks, results and replays, buyer speed figures, world-class analysts, and live news straight from the track, and so much more. Founded in 1894, DRF has multiple electronic platforms in addition to its daily print vehicles. Daily Racing Form, enjoy horse racing with the team that loves the game as much as you do. So we'd like you to welcome to the stage Dr. Dwayne Rodgerson from Haggard Medical, who will talk about joint, bone, and tendon issues. These are horses, not yours, that may have an impact, as well as surgery options, layup considerations, proper nutrition, and exercise. Please welcome Dr. Rodgerson. And Doctor, I got this left knee thing going on here.
Thank you.
All right, Dwayne.
All right. Let me see if this is going to work. Is it? Okay. Well, I'd like to thank everybody for showing up. I really appreciate the invitation here. Gary had sent me a list of topics to try to get over in 40, 50 minutes, and it was kind of a long list, so we're going to get through them quickly and hopefully cover all of them. But going through some of the issues, and you'll see that they do overlap, and we'll get to kind of more of the interesting stuff near the end, kind of the stuff that I do, surgery. But they all kind of overlap. First thing we're going to kind of get into is nutrition. And I'm not a nutritionist. I know the basics about it, but it does play a very important role in developing a racehorse. If you look at foals and young racehorses, yearlings, weanlings in Lexington, Kentucky, on that beautiful bluegrass, they grow up eating, that very sweet grass. But when they finally move out of Lexington and get into the kind of training atmosphere, they have to kind of start taking in dry hay and copious amounts of grain. So their diet changes. But they have to have important, components to their diet, and that includes protein, minerals, vitamins, and carbohydrates, and fat. If we look at protein, that's very important in building muscle, as we know, as well as strong bone. The protein diet should contain at least 12% of crude protein. You should look at trying to get the best quality protein sources, and most of the commercial feed now, it's very well put together and does have good quality protein. Grain rations, such as soybean meal, are very important. There's also some other types that have lower quality. So you have to kind of make sure you're feeding good quality protein. If you look at the types of hay, alfalfa usually contains 12 to 25% of crude protein. Some of the poorer quality hay, grass hay, the protein level drops a bit. If you look at minerals, the two important ones are calcium and phosphorus. These are very important macrominerals, important in bone. You should have sufficient quantity and the correct proportions. Forages are high in calcium, a little bit lower in phosphorus. You look at the grains, they're generally the opposite. Higher in phosphorus, a little bit lower in calcium. The commercial feeds usually contain equal amounts. If you're worried about not getting enough, you can supplement calcium, either in limestone or calcium carbonate. Molasses is also a supplement that can be top-dressed on the feed. If you feel that you're not getting enough minerals, add a salt block, either in the form of a block or a loose spread over the feed. Other minerals, and we'll get into these in a little bit, zinc, copper, and iron, as well as the vitamins. B vitamins, most of the time in good quality feed, they're getting all the B vitamins they need. If you feel they're not, you can potentially supplement it. Brewer's yeast is a very inexpensive method, but most feed, if good quality, horses are getting their B vitamins they need. To be a racehorse, You need good energy sources. The two energy sources are carbohydrates and fats. Carbohydrates, if you look at the first one, forages, should be at least 50% of the horse's diet. If you look at grains, also providing carbohydrates, their types are oats, corn, barley, and most of the feed, commercial feed, will have these in it. Fat is another energy source, usually in the form of vegetable oil. It's an excellent energy source, and you can potentially decrease the amount of grain you're supplementing. And most commercial grain rations have anywhere from 6% all the way up to 10%. You can top dress it with vegetable oil if you want to add more. So it's easy to kind of feed a horse and try to get the horse into what your eyes think the horse should look at. But it's very important to be critical on what body condition this horse is in, because you can potentially have the horse too light, you can potentially have the horse too heavy. There is a body condition score out there. It's graded from 1 to 9. It's important to monitor this so you can prevent injury and potentially improve performance. The healthiest body scores are in that range of 4 to 6. If we look at the body condition of 4, looks like the horse is in shape. It's called moderately thin. It is a little bit thin. Kind of the score in the middle, it's called moderate, is a score of 5, and it's usually the condition that you'd like to see your racehorses in. If you get into condition 6, you can see that the horse is a little bit heavier, has a little bit more flesh on it, moderately fleshy, that's what we call it. It's a little bit heavier. You usually see this in, say, the younger 2-year-olds, and as they get into exercise, more intense exercise, they get to that next level, a condition score of 5. If you get up into the heavier ones, 7 to 10, it's very important to try to prevent getting these horses too heavy, especially if they're in training. If they are heavy in training, you can start cutting back the diet. You can keep them in exercise, but don't try to push them too hard. If you push them too hard, you're going to put more stress on the bones and the ligaments, and you're not even going to get that young horse to the track. So it's very important to look at that body condition score and hopefully maintain it at a level that you can progress through the early training stages and get to the races. If they're too thin, you got to look at what you're feeding the horse, making sure that the horse is getting an adequate amount of nutrition, getting the right types of feed, but also start thinking the worst. And as a veterinarian, I tell all my interns and my residents, think the worst, think the worst, think the worst, think the worst, because be prepared for it. In this situation, you start saying, okay, is the horse's teeth okay? Is the horse, properly wormed? Is there something else going on? Building bone density. So proper nutrition will help build bone density. If you look at just some guidelines here, growth of the equine athlete. At 6 months, they've reached about 85% of their mature height and about 50% of their mature weight. But 6 months later, they move up to about 95% of their mature height and 65% of their mature weight. So they're still, at 12 months, have a ways to go. By 22 months, they pretty much have stopped growing, and they're at about 90% of their mature weight. If we look at their bone mineral content, at about 6 months of age, they're about 70% complete. 12 months, about 75% complete. And bone mineral content doesn't really completely finish until they're about 6 years of age. So building bone density, you have to first understand what bone is made of. And two parts are the collagen, the protein matrix, which is the flexible framework. And then you look at the calcium phosphate and the calcium carbonate. These are the minerals that add strength and harden that framework. And the combination of these two gives bone its strength and its flexibility. So keep it simple. So always think the worst, keep it simple. That's the other thing I always say. Nutritional factors, back again on nutrition, that influence bone density are minerals, vitamins, and protein. Racehorses fed a well-balanced, well-fortified diet, they're being given the most important factor that builds bone strength. But the other component that plays into this is exercise, and we'll get into that in a minute. Minerals that are important in bone formation are calcium, phosphorus, magnesium, copper, and zinc. A balanced dietary intake of minerals is critically important. needs to be balanced or it can potentially affect the absorption of other minerals. Calcium phosphorus should be 2 to 1. That's the ratio. Higher ratios potentially affect the absorption of other minerals. Magnesium, important in that protein component. Copper, also important in that protein component of the bone's framework. And zinc is very important in the process of ossification of bone. So important that these horses are getting the right minerals. As well, vitamins. It's very important in formation of bone, having the right vitamins. Poor quality hay can lead to vitamin D deficiencies. Vitamin D is important in the absorption of calcium and phosphorus. Vitamin A deficiency, again, poor quality hay. Loss of bone strength, thinning of bone cortex, if you have deficiencies. Protein, we need to build that protein matrix, so we need to have a good protein source. Protein provides that framework. Protein quality or quantity, that's the amount of crude protein in the feed. That's important, but protein quality is more important. You have to have the proper amount and the essential amino acids. This is crucial to prevent deficiencies. So diet should contain high quality protein, so you provide a solid framework for that bone. As well, deficiency in certain amino acids can affect bone strength as well as depress growth rate. So you must ensure that your feed is providing those essential amino acids, those 10 essential amino acids. I said, if you don't, you're going to affect protein synthesis and indirectly affect bone strength. Good sources are alfalfa, soybean meal, and good quality feeds. So we take that nutrition and then we now start to apply it to the bone strength, how it plays in. Racehorses must develop that proper bone density to maintain training and racing. Bone has the ability to adapt and strengthen to the forces that are applied to it. Wolff's Law. It's a law that in vet school we always learn about as far as, the studying bone. Higher bone or healthy bone adapts to the physiologic load which is applied. Load, if it's increased, you'll see the bone remodel and the bone becomes stronger to resist that load. If that load goes away, bone gets weaker. You'll see that in horses when you put them in a cast. If they're in a cast for a long time, you'll see that bone start to just kind of get less dense on radiographs. I said bone strength depends on diet. However, exercise is very essential in building strong bone. It stimulates bone growth and strength. If you look at studies looking at weanlings that are kept in, say, a stall or kept turned out for at least 12 hours or all day, the weanlings that are kept out getting exercise, their bone density is 30% higher. So exercise is important in building up bone density. Bone, again, is dynamic, constantly remodeling to the forces that are applied. If you look at the strains on a bone, bone has, if you look at just these 3 strains here, you have compression, a downward force, and then you have tension, pulling on the bone. And then you have twisting forces on the bone, torsion forces. If you look at the metacarpal bone, the cannon bone of the horse, the dorsal surface of the 3rd metacarpal bone is under tension when the horse is in a slow gait. So if you get a horse in training and you're just going to build this horse, you're going to train it in a slow gait, that dorsal cortex, the front of that bone, has a tension force on it, a pulling force. But when you get into the racing environment and measuring the strains in that cannon bone, then becomes more compression, more of a pounding force on the front of that cannon bone. So if we look at just a horse getting broke, getting trained, getting fit, it's doing slow gallops, that bone is under tension. So the front of that dorsal cannon bone is being pulled. But when you get into more speed work, breezing, the strain on that bone changes. And bone has to adapt to that change. So long galloping exercise increases the risk of buck shins. High-speed exercise in small doses, based on studies out there, and one of the guys that's done most of the work, veterinarian Dr. Nunemaker, has shown that high-intensity exercise can potentially be protective against buck shins. So if we look at dorsal metacarpal disease, the cannon bone, buck shins, 70% of young thoroughbreds are affected by this in race training, usually 2-year-olds during the first 6 months of training. It's repetitive loading injury in the third metacarpal bone, cannon bone. It's a fatigue injury of horses. And tibial stress fractures, I believe, are very similar to that. It may be bilateral, but typically in North America, it's the left side, and that's due to the counterclockwise as well as the lead changes on the left. How do you diagnose buck shins? Fairly straightforward. As Dr. Thorpe, one of my mentors, told me, he said, there's very few good veterinarians left. And I said to him, what do you mean by good veterinarian? He says, there's very few good veterinarians left. He said, ones that are good observers, ones that want to use their eyes, their hands, their ears. All young veterinarians want to go get an ultrasound, a bone scan, x-ray something. But use your basic tools to figure a lot of these out. So if you look at history, a young training horse, clinical signs, swelling over the front of the cannon bone, increased skin temperature, painful to palpation, these horses are sore. And generally, the swelling is on the inside of the leg. And when you get a stress fracture, it's on the outside of the leg. So buck shin's typically on the inside of the cannon bone. If you do take a radiograph, what the first thing you'll see is the thickness of that dorsal cortex, the front of the bone. And I outlined it there with lines, and you can compare the one with the 2 arrows on the right. You can see how much thicker that shin has changed compared to the one on the left. If you're unsure and you want to get more diagnostics to see if it's a buck shins, you can send the horse for a nuclear scintigraphy. Nuclear scintigraphy, it's basically injecting the horse with a radioactive pharmaceutical, a drug, and it gets taken up in areas of bone that are metabolic active, such as growth plates or areas that are inflamed. And you can see on this images here of this bone scan, you can see the left shin has quite a bit of uptake in the middle of the shin. I don't know if I can reach all the way to the shin. So you can use scintigraphy, but generally you don't have to. If you look at the old horsemen and stuff, the old rules was buck shins occur and they resolve. They have to go through it. They generally go through it and then they don't have any problems down the road. The bone gets stronger. Observation by some training programs is that you have to push them so they get buck shins and get them through it. However, if you do that, you do have risk of the horse being pulled out of training, losing potential racing days. You have the horse at risk to developing a stress fracture, what we call cortical fracture, a fracture in the cortex of the cannon bone. And in about 12% of the horses that get buck shins will get stress fractures. Stress fractures are typically on the outside of that shin. As well, it could lead to catastrophic failure. So if you look here at buck shins on the left, you can see how thick that dorsal cortex is. And as you go to the next radiograph on the right, you can see a little line right where the arrow is pointing. And that's a typical stress fracture of the cannon bone. And that's a red stop sign. Stop. If you don't stop and you keep pushing these horses, they can potentially get a mid-cannon bone fractures. And 10% of the fatal catastrophic injuries are due to cannon bone fractures. So if you do have a stress fracture or the possibility of that occurring, you have to back off on that horse. So treatment. Conservative management does work. We got to give Mother Nature some credit sometimes, you know. You get surgeons up here and they talk about how golden their hands are, they were born with them. It's crap. Mother Nature does a very good job. Time is very important. You got to let these bones settle down. You got to let these fractures heal. Generally, 60, 90 days. You want to treat the inflammation, anti-inflammatories, as well as cold therapy. That's the basics. You're going to get other people selling you some other alternatives, such as shockwave. You can do that. Doesn't do any harm. It does, in a sense, get rid of the pain. Does it stimulate healing? The other thing you're going to learn about me here, I'm a skeptic. I don't believe in a lot of stuff. So I'm kind of on the fence on this as far as stimulating healing. At the racetrack, this is something racetrack veterinarians can do while the horse is at the track to hopefully treat buck shins. And it's where they go and they scrape the shin to stimulate healing. I'm on the fence on that. Another thing that you'll see your trainer or some recommend is to blister the shins, stimulate healing. There's many products out there. It's a counter irritant. It's basically just putting a caustic irritant on your skin and hoping it gets deep enough to help that shin, stimulate healing. But you're also giving the horse time off. Pin firing. I'm sure everybody's heard of pin firing. It's not used in Europe. It is used in America. A lot of trainers believe it works. I think it does deaden the pain. It deadens the pain because it damages the nerves on the front of the skin, on the front of the shin, the skin. Does it get deep enough to stimulate healing? I'm on the fence, but a lot of trainers want to do it. If you don't do it, then they will always point the finger that that's why this horse isn't performing well. You should have fired the shins, you should have fired the shins, you should have fired the shins. But the horse is also given time off. Now, I'm going to throw this out there. If you went into the doctor and you had a sore knee and he said, I'm going to pin fire it, you'd run pretty quick. Horses are no different than us, the way they heal. And for us to sit there and think they're different, we got to take a step back and really look in the mirror. They're no different. So building the equine athlete. Training adapts bone to training. Training, which mimics racing, adapts that bone to racing environments. Different exercise programs can change the shape and substance of the bone. Hard surface can potentially strengthen the bone. And I was talking to Jackie Ramos the other day. She was by the clinic, and I was talking to her, and I like listening to people tell stories. And she was telling stories about jogging horses on asphalt to stimulate that bone. And, that's probably did stimulate that bone. So Dr. Nunemaker talked about in his hard work on buck shins that training racehorses requires speed work. He said it doesn't take more than breezing just under 1/8 of a mile, 2 or 3 times a week. This signals bone formation, cutting back in the number of long, slow gallops. It's not going to those gallops are not going to strengthen the bone sufficiently enough for racing. So early speed work for short burst helps avoid buck shins, increases the bone mineral content, helps remodel bone so that it can handle the forces of racing. So we could spend a whole hour talking about buck shins, so I'm going through these pretty quick. Now, as a surgeon, we're getting into the stuff kind of that I'm into. Common joint injury, surgery options. We'll look at the common joints. If I have a racehorse in front of me, I'm going to look at the common spots. Knee, fetlock, tibia. If I have a warm blood in front of me, I'm going to look at feet, hock. So you change. Racehorses have certain spots where they get injuries. If we look at fetlock fragmentation, anybody that has racehorses, you're probably going to get one that gets a fragment in the fetlock, a chip in the fetlock, a flake in the fetlock. It's basically just a small piece of cartilage and bone. It's bone covered in cartilage. That's what it's like. And it will inflame the joint and cause the joint to be distended. And they generally don't heal back because the joint fluid in the joint washes away the blood clot when these piece breaks off. So it doesn't heal. So it sticks back down, but it doesn't heal the way it should. So it keeps that joint inflamed. So getting rid of it is important. The good thing is if you get it soon, you can get it out, and these horses can go back fairly quickly, as early as about 6 weeks to light training. But you can see on these radiographs, I circled it on the radiograph and then zoomed in. You can see the small cartilage bone fragment. A little bit more serious injury, the sesamoid fractures. I've got 2 views in here, one from the side and an oblique. And you can see the fracture at kind of the top of one of the sesamoids. There's 2 sesamoids in the fetlock. And these are very important in the suspensory apparatus, very important in supporting the fetlock. And when you break these are a serious issue. And where the break is can be less serious or more serious. This one is a little bit more serious because it involves a lot of the sesamoid. So these can potentially be career ending as far as a racehorse. We don't usually take them out when they're this big. If they're small, we can. If they're off the bottom of the sesamoid, it's a bit more concerning. Just when we're generally treating conservatively. Some people talk about putting screws in there or wires. In my mind, I'm on the fence again. I don't feel that it works. Fractures. A very common fracture in racehorses is a condyle fracture, usually on the outside of the condyle. Sometimes they're on the inside. This is what's called a non-displaced incomplete. Incomplete meaning that it starts from the fetlock joint and goes up, but it doesn't break out as it goes up the leg. So it's incomplete. These ones can go back. These ones you can fix, and they potentially can come back if you give them time. And we go in and we put anywhere from 1, 2, maybe 3, usually 1 or 2. If they're displaced, and you can see the difference in this radiograph where it breaks out as it goes up the leg, this is a concern because you get a joint issue down here. There's a step in the joint. You get a lot more cartilage damage. You get a cartilage damage in the back of the joint. And these horses, even though you can fix them, and you can pat yourself on the back, and I can say, oh, it looks good, horse is going home, these typically don't go back. So if you have one of these, it's more concerning. Another type of fracture in the fetlock is a pastern fracture. More common, I feel, in standardbreds than we do in thoroughbreds, but it's fairly common and fairly straightforward to fix. And these horses can go back. This is probably one of the best studies, I think, in the last 10 years that came out, was showing that you can fix these fractures standing, those condyle fractures, those ones that are, I'll back up, that are non-displaced. You can fix these P1 fractures that don't break out. You can fix them standing. And you basically just are blocking the horse, just like going to a dentist. You block the leg so that you can put your screws in. And it's fairly quick and fairly easy, and you avoid the risk of anesthesia. Because I have seen them fracture in recovery. And it's pretty, it's very disappointing when you see that. If we have to put them under anesthesia, we do. But if I could potentially do it standing, I'm going to try. If we look at the carpus, fragmentations in the carpus, another very common thing. And it varies in where the chip is, how big the chip is. Chips in the knee, if it occurs racing and it's in the middle of the joint, I tell my owners, my clients, they're typically coming down the curve. So if you got a horse that's a 2-year-old and you want to bring him to the Derby, it very rarely happens. They're typically coming down the curve if that chip occurred during a race or in training, and it's in the middle joint where this arrow points. It's generally they're coming down the curve, and it's due to the cartilage damage. The piece itself is really not that big. It's just the cartilage damage, and they get arthritis. In the top joint, these fragments can be quite extensive and quite large, but the cartilage damage isn't as bad, and these horses can go back and race and chip again. So we also could spend an hour talking about knees or chips in the knee. But the reason these horses don't come back is because of the arthritis. And this is the reason you'll see at the track horses potentially getting their knees injected to try to control that inflammation from the arthritis that develops. This is a more serious injury here. This is a slab fracture. Just like that displaced condyle fracture, that complete condyle fracture, these horses don't come back. So if you have your veterinarian telling you have a slab fracture, they're not going to be a racehorse again, typically. If they break out completely, complete slab, the prognosis is poor. If it's incomplete, some of them can go back. And we'll go in and we'll put a screw in those. And then hock fragments, usually OCDs that cause the hock to be swollen, so the horse is training, its hock swollen, we can get those out. And we get those out by going in with the arthroscope. And you have your horses go in, have arthroscopy, we just go in, we put the camera in the joint, and you can see the chip here on the front of the fetlock here. You can see the small fragment, and we go in with instruments and we take that fragment out. Same thing here with the knee. If you look at this knee, there's not much cartilage surface in the knee to begin with. But when you get a chip, you can see how large of a defect, how much cartilage loss you have. And that's the reason that these horses do poorly. It's not that the surgery was done wrong, or you should have sent it to somebody else, or that, it's usually the cartilage damage, the arthritis that sets up. That's just showing the fragment. Other injuries we get, soft tissue injuries such as lacerations. These are very straightforward. They can be, as you know, small to like, oh my God, but we'll suture these things up. Muscle injuries, this is just an oddball thing. Racehorses in training can tear their muscles. This is a nuclear scintigraphy over the back of the horse. And you see these two black lines here. This is highlighting the pelvis. These two black lines here on the other side, here and here. This is the camera over the pelvis, looking at the pelvis, and this is muscle tearing. So horses can do pretty severe muscle injuries while in training, as well as bone. Bone injuries, we also have soft tissue injuries. 4 common areas that we see injuries of the tendons in the lower leg are the superficial digital flexor tendon, the deep digital flexor tendon, and the suspensory ligament, as well as the sesamoidian ligaments down low. The most common is the superficial digital flexor tendon that everybody's heard of, the so-called classic bowed tendon, the swelling just above the fetlock in the back of the leg. These can also occur higher up, but this is the classic location for these. Origin of the suspensory, you have them down low, up high, that's the origin, and then the insertion is down low. Those are 2 areas that you can see injuries. Now, as everybody knows, we have this all figured out now. We have regenerative medicine therapies. It's a popular therapy being sold by veterinarians. The key word there is sold. Options available. We have IRAP, interleukin-1 receptor antagonist protein. That's IRAP's short for that. PRP, platelet, enriched plasma. A-cell was one, but that's kind of gone by the wayside. And the next one, stem cell therapies. Veterinary medicine is being hit hard with these therapies, as well as the human field. Very, very, being pushed pretty strong. Types of lesions we use to treat them with are tendon, bone lesions. Clinical claims are unbelievable. Owners, you're going to be hit with all these claims that it fixed it, fixed it, fixed it, fixed it. Remember, I sit in the fence. It came out initially that this is the way. This is all you have to do. Veterinarian, you walk in, you put a needle in the sternum of the horse, you collect bone marrow, and you take that bone marrow and you inject it into the tendon injury. And here's a hole in the tendon here. You can see it bowed tendon. Hole in that superficial, right at the very top here, a nice hole. And we're going to go in with a needle, and you're going to see the needle is the bright white line going into the lesion. And we'll inject stem cells in there. And abracadabra, it's healed. Here's an example of doing a suspensory branch. And people pay me for my opinion. I'm not selling something. And I'm a big skeptic, and I tell my interns, my residents, I say, be a scientist. Question everything. I question myself every time I'm in a colic surgery. I'm like, okay, did I fix it? Did I get it? Did I get it? I'm triple checking myself. So always question. I say to them, don't be a magician. This is a suspensory branch here. Now I want you to look, like there's people out there that wake up in the morning thinking about stem cells. And they go to bed at night thinking about stem cells. And I'm not convinced the veterinarian has figured it out over them. These people are running $1 million labs. That's all they do all day long. And as I said, it's being pushed in the human world as much as it's being pushed in the veterinary world. I'm going to play this, and I hope the volume's working.
What can stem cells really do today? We asked a scientist who's doing some of the world's most advanced studies in stem cells, Dr. Joanne Kurtzberg.
This is from 60 Minutes.
I believe stem cells have a lot of promise, but we are way at the infancy because real stem cells are very difficult to control as therapy. I personally think we're 10 years away from seeing real cell therapies that are working and are safe, but I do believe it will come.
Dr. Kurtzberg is a physician and the chief scientific officer of a stem cell research program at Duke University. She advises the federal government and is the co-director of this multi-million-dollar laboratory which works with stem cells harvested from umbilical cord blood. Dr. Kurtzberg told us there is no evidence yet that stem cells can treat cerebral palsy. Some of the diseases that we see stem cell cures offered for on the internet include multiple sclerosis,
There are no stem cell cures yet for multiple sclerosis.
Lou Gehrig's disease.
I wish there were, but there are not.
You know, I wonder how often it happens that you have to tell a patient, I'm sorry, there's nothing we can do. And then they come back to you 2 days later and say, well, I see all these cures on the internet.
I get many of those calls and emails and see many of those patients, but it's very dishonest to mislead people when there's nothing you can do.
So it's very similar in the equine world. It's okay to try. They typically don't do any harm, but you got to question stuff. There's nothing wrong with questioning it. There's lots out there on it. I do agree that it's potentially going to be the future, but certain things that it's being used for in horses, it doesn't work. When to lay up your racehorse. This is an important decision. You want to treat each horse as an individual. You won't hear me use stats too much, like, you got to treat them all as an individual. Everyone is different. You got to listen to the trainer, the exercise rider, the jockey, and veterinarians. And again, question them. You own the horse. You have the right. Question them. Minor injuries can lead to career-ending injuries. One of the most common thing I see is a horse that's off behind, and then they come in for a bowed tendon in the front. And if you watch the horse go, he's off behind. He's getting off the right hind and hitting harder in the left front. Observe what's going on. Listen to them. If they say the horse is not moving well, you keep pounding on the horse, something could go. Factors affecting your decision when to lay up a horse: age. When they're 15, not performing well, you might stop. Time of year, end of the year, end of the good races, you're going to give the horse a break. Joint effusion. You have a joint that's just kind of popped up. You want to give it a break. Lameness. Try to figure out why the horse is lame. Maybe it just needs a little bit of time off, but try to give the horse a bit of a break. Poor performance. And a clue sometimes to an owner when you're not at that spot is look at the veterinary bills. Sometimes the veterinary bills are going through the roof, and they're more than, say, doing a colic surgery. Okay, there's something going on here. A lot of these layup facilities have, in Lexington, you get them there, they get turned out in a paddock. You want to give them a break. Once they've received their break, you want to get them back into light work. A lot of these training facilities can put them in an exerciser. They can potentially take them to facilities that offer, swimming as form of an exercise. But as we went through building bone density, this could have a negative effect because you're not going to get that hard pounding on the bone. But this could have a benefit effect on trying to get a horse fit that has a soft tissue injury. Once the horse has been given its time, you can start bringing that horse back, trying to get him back into condition, building him up, getting that bone stronger again, trying to get some of that weight off. Because once they're turned out in those lush paddocks, they'll get big again. So you got to bring them back and try to get that body condition decreased a little bit. And then the question, especially when it's a really good horse, when do you retire a racehorse? Again, age, poor performance, and that can be in the form of lameness. It could also be in the form of upper airway issues, as well as arthritis, osteoarthritis. Both mean the same. In the fetlock, the carpus, or other joints are the common ones. If we look at upper airway issues, laryngeal paralysis. Racehorses need a great throat. I just looked at 3 of them last week that, young horses, and you're like, it's going to be hard to move this horse up the curve. If you got a really good horse that's winning races up here and he becomes paralyzed and you do a tie back, they got races to win coming down the curve. If you got a horse down here and you got to get him to the races with a tie back, odds are it's going to be difficult. Because most of these horses after surgery, even though you pull it up, and it's not a hard surgery, is that when they breathe in with such force. It's like you breathe in really hard and you feel your nose collapse. That surgery site also does that too. And with time, that side comes in. So, and studies have shown they all come in, no matter who does them. So they're eventually going to fail. So that's just showing a left-sided laryngeal paralysis. This is arytenoid chondritis. Same thing. It's affecting that arytenoid and causing that side not to function the way it should. And again, racehorses need that perfect airway. Other things you'll see where they get entrapment. When they get epiglottic entrapment, we can potentially work on some of those. Knock on wood, you know, there's an odd one that just goes bad on you, but generally 9 times out of 10, they go very well. And the other one is dorsal displacement of the soft palate. Arthritis of the joint. These are 2 pretty good extreme examples of arthritis of joints. One's a fetlock and one's a knee. The fetlock's on the left, and you can see there's quite a bit of new bone proliferation on the front, on the sesamoids, and that's concerning. And the only way you're going to keep a horse that, you know, in training with bad arthritis is to keep injecting them, and that's not right for the horse. And you're going to have to be injecting corticosteroids to try to get them to the races. Same thing with the knee. These horses you should just stop for the sake of the poor horse. And I got a minute left, and is that 40 minutes or is that 50? Huh? Want me to keep going? I got a few more slides on laminitis. They wanted me to talk about laminitis, so, you know. And Lady Eli's in there. She had laminitis. So whoever worked on her fixed her. And I know the guy who worked on her, Brian. He's really good, but I'm going to show you here in a minute. Equine laminitis, inflammatory conditions involving the foot. Very simple. It's just inflammation of the foot. What are the predisposing factors? We'll go over some treatment as well as the prognosis. Most of the time, it's rations high in carbohydrates. In mares, it's usually after foaling, as well as in cases where they get sick. Horses, like people get sick, you get like a gastritis, you're throwing up, you get a GI bug. Horses can get the same thing. And when they do, and if they lose the lining of their intestine and they lose that protective barrier, they get even more sick. And those toxins that they absorb can cause them to founder, get laminitis. Trauma, you know, on hard surfaces and stuff can potentially cause them to founder. Certain toxins can cause it. Stress. Stress is a case, say, if you have a horse that had surgery on one leg and it can't put weight on that leg anymore, or it's going to take time before he puts weight on that leg, especially horses like what Barbaro went through. Everybody knows he had a hind fetlock fused, so he's standing on one leg all the time. And if you did that, I'm starting to collapse here right now, but if you kept doing it all the time, your healthy foot's going to break down due to that stress. High doses of corticosteroids. So you got to be careful if you got a horse that you're putting steroids in there. High doses can cause it, as well as metabolic. That's usually in older horses. So if you look at the foot, it's like our fingernail. It's like our fingernail. It's the intricate attachment between the hoof wall and the third phalanx. You have forces on that foot. You have gravitational forces. You have the forces from the ground coming up on the foot. You have the pull of the deep digital flexor tendon pulling on that third phalanx. You have the little bit of a pull from the extensor tendon. And then you have this laminar attachment. And the hoof wall is attached to that bone really, really tightly. And you can see both the red and blue histo slide here. That's that intricate attachment. The red is the hoof wall. The blue is the sensitive tissue. And you can see how intricate it is. And when you get laminitis, you can see the separation, just like your fingernail coming off your finger. So clinical signs of acute laminitis, usually 24, 72 hours after the insult. You'll have an increased digital pulse. The feet will be warm. Horses may be depressed or anorexic, especially if they have a GI bug. Commonly affects both forelimbs. Both forelimbs, why forelimbs? They bear most of the load. That's why it's more common in front legs. Hind legs, it's less common, but it can occur. If I had a horse that I had fused a fetlock on in a hind leg, I usually have more time, hopefully that horse, to bear weight on that leg than I do a front leg. Laminitis will come quicker in a front leg than a hind leg, and that's just subjective. Lameness, characteristic lameness, front feet placed out front. Hind legs extended underneath them. They have a very stiff gait and total resistance to move. They don't want to come out of the stall. They don't want to follow you. They don't want to move. Muscle tremors. And I have seen veterinarians call me and say, listen, I got this neurologic horse. I don't know what it's doing. Can you come look at it? It's neurologic. So a lot of people will think they're neurologic when they actually have laminitis. So the classic gait, front out in front of them, front feet out in front of them, hind feet underneath them. And you'll see horses that are sore in the feet don't really have, in a sense, true laminitis, but they also move like this. Especially a racehorse, you take their shoes off and get them on a hard surface, they move like this. History, clinical signs, be a good observer. The classic thing they always tell you in vet school is that you put the hoof testers on the toe and they react. Generally, some may not. You're going to get radiographs. It's important to get radiographs right off the bat because you want to get a baseline. And you're going to get your various views, one from the side, one from the back. And you want to measure sole thickness, hoof wall thickness. You can do other measurements where you're going to look at the alignment of the coffin bone, the third phalanx. And you're going to look at it, and here you can see there's this, compared to the first shot, the alignment, it's nice and even or parallel with the hoof wall. And when we go back to this one, you can see that the coffin bone has changed. And you can do measurements here where you got A should equal B. And if we come in here, should show nice parallel alignment. If you got laminitis, you'll see that A and B don't equal each other and that B is a greater angle. So that's rotation. Generally, when you x-ray them initially, that's going to be equal, even though the horse has laminitis. But you're getting a baseline so you can compare down the road. Laminitis should be considered an emergency. Critical to start therapy immediately. And as I said, every case is different and they respond differently. There's a poor prognosis in larger breeds. Ponies, they can founder a dozen times. Like I have a pony at home. He's big as a house. But he's foundered so many times, but he just gets along. Does fine. But in race horses, draft horses especially, they're done sometimes. And cases vary from mild to very severe. And as owners, I sometimes feel sorry for you because you're going to be hit with tons of therapies. You're going to be hit with, oh, I had a horse with laminitis one time and I just did this. I had a horse with laminitis and I hung onions in the stall. I had a horse with laminitis and I put 2 dead chickens. There's so many things out there that you're going to be hit with. And every case is different. You have cases that are really mild and cases that are severe. And the ones that are mild should be called horse-survived laminitis. And the bad ones should be said, horses are going to be euthanized. But the problem is we use one term to categorize a very big spectrum of cases. And the mild ones, they can go back and do what Lady Eli's doing now. But the ones that are really, really severe, it's sad. And a colleague of mine told me once, he said, horses don't really die of laminitis, which is true. In the wild, they get eaten probably by an animal, if we had predators. But most of the time, owners get frustrated. Owners get frustrated due to the lack of improvement. They want this horse to be back the way it was. And they just get frustrated, veterinary bills, and they see this horse that was just beautiful, and now it's a rack of bones, and it's just, its feet are coming off, and it can't move, and owners just finally give up. And it's really, really sad. And there's a lot of research going on, a lot of good research going on to try to figure out and address laminitis, but a lot of it's in prevention, and sometimes it's hard to prevent them. And if it's bad, it's just sometimes bad luck, but you do everything you can, hoping that you can move the horse at the far end of the right, maybe a bit closer to the middle, and maybe you can get a few of them through it. Owners should understand the severity and cost. Some of the costs of treating laminitis can get quite extreme. You want to put together a team, a veterinarian, a farrier. All right? Some farriers out there are very good at this, and they enjoy treating these cases. These are tough, tough cases. They're not cases that are going to go away. Years. The most important is to treat them initially, prevention. The most important is to try to get that inflammation out of the foot. Treat them aggressively with anti-inflammatories. Ice those feet. Try to shut down that inflammation. That's the key. You want to control the pain. Deep bedding. Get them in a deep bedded stall. Don't try to move them. If you take your fingernail and it's loose and you keep moving it, it's going to come off. So you don't want to keep doing that. There's foot supports that you can add, try to help keep their feet comfortable. You've got to get them through that inflammatory phase. There's various products out there you can use, but key, inflammation, ice, anti-inflammatories, ice, keep them restricted to a stall. Foot cast in some of the severe cases, just showing you a foot cast. Body weight. And if you look at those bad cases that have laminitis, you see them go from a beautiful looking horse to just a rack of bones. That's Mother Nature. That's Mother Nature doing what should, trying to get that weight off those feet. And you got to get these horses light. Chronic laminitis is the same anti-inflammatories if they go through a more acute phase, icing if they go through acute phase. But again, deep support, supporting that foot. You're trying to prevent any further damage. Just going through quickly here to finish up. Lighten them up. If you can lighten them up, you can potentially get some of these horses through. These horses, when they get into chronic laminitis, they don't have a good foot. They don't have good blood supply. The blood supply has been damaged. They're more susceptible to abscesses, more susceptible to problems. So you got to take good care of that foot. You're going to have to debride it, not get too aggressive, not try to change what they have under them. Do things subtle. That's the key. Subtle changes. There's many shoes out there, many products you can try. Keyword is try. Some horses like a shoe, some don't. Try. Be willing to change back if it doesn't like it. There's some surgical options out there where we cut tendons and stuff. It was popular in the 90s. It's getting a little bit less unpopular, where we go in and we cut the flexor tendon. I usually am not doing that anymore. Some of the podiatrists in the area are doing it. Maybe I'm not seeing those cases, but it's still being done by some of the podiatrists. It's fairly simple. You do it standing, and you're trying to take the pull of the flexor tendon off P3. Slings, you're trying to take the weight off the horse. Trying to put them in a sling so there's not as much weight, not as much gravitational force coming down. And a study out of France, which I thought was really interesting, and it was just an abstract. When I did my research in laminitis, so I was reading this abstract, and it was one abstract that I tell people about because I thought it was a good idea. If you went in and you had an injury, severe, and they wanted you to protect your leg, they'd have you lay in bed, and you'd protect it. Horses, they have to get back up. They want to get back up. Some horses, if they don't lay down, you're probably going to lose in laminitis. If the horse is really, really heavy, you're going to lose in laminitis. But if the horse does lay down and protects itself, those are the ones you can potentially win on. So that's one of the first questions I always ask, does he lay down? And the study out of France, what they did, they lowered the ceiling. So they made horses lay down. And if horses would tolerate it and you could keep them down, you could potentially for a few weeks, maybe a month, support those or help support those feet. Again, decreased body weight, decreased body weight. Everybody wants to have their horse nice and big, but just decreased body weight. Amputation, I discourage this. There's veterinarians out there that'll do it, I discourage it. They'll eventually break down the other leg, depending on the size of the horse, but very rarely my colleagues, myself, we're doing amputation. Stem cell therapy, you heard me talk about that. That's out there for laminitis. Fix it, fix it, fix it. It doesn't. You'll spend a lot of money as an owner. I would tell you to use your money somewhere else, but it's out there. So every case is different. Horses that have increased body weight or never lay down, they're going to have a poor prognosis. Commitment to owners. Owners sometimes want to do everything they can, but just hope your horse is more in the middle of the spectrum and not all the way to the right. And horses that get a rotation of greater than 11 typically have a poorer prognosis, or if you get sinking, where they lose a lot more laminar attachment. So, thank you.
All right, thank you, Doctor.
Sorry, I went over a bit.
That's okay. We're going to make the double. Don't worry about it. That's the important thing. But that was extremely informative. You just read, you read the word laminitis, and well, you guess you know a little bit about what it might be. But now there's this great understanding, and thank you for all that information. Appreciate it.
Thank you.
We'll keep your computer. Don't worry about it. We'll get it back to you. Oh, it's their computer. All right. Well, I'll take it. I love duct tape. You can do anything with duct tape. This is attached to the with duct tape. All right. So we'll just have to work with it. Sorry about that. Okay, so we want to thank our sponsor for that segment, Daily Racing Form. But we're not quite done yet. We have one more speaker who's going to join us in just a moment or two after we do a little more housekeeping. I really hope you've enjoyed the conference. This is our fourth one. I think they've gotten more informative, more fun, better managed every year. And we hope to come back again next year. And we hope that you can help us make it a better conference. So we're going to email you a survey. And if you could, help us with your ideas and your criticisms, good and bad, and we'll see if we can continue to build on owner-view. So they'll be sending that to you via email. And really a huge thanks to all of our panelists and speakers. I mean, this is a very busy week for a lot of people in this industry, and they've taken the time out to come here, and we want to thank them very much for their participation. But the fun and festivities not over yet. We are still going to have our lunch and day at the races to look forward to here at Del Mar. And the special opportunity for all of you who have been here, we want to take this opportunity to thank our sponsors for lunch today, the California Thoroughbred Trainers and Harris Farms. And a quick few reminders here. The shuttles are available to take you to and from here to the track. So please just refer to your shuttle card, and that'll give you all the specifics you need for that. And again, our folks, our volunteers will help you get on and off the bus. And again, please take all your personal belongings and credentials, what have you. And remember that if you have self-parked here at the Hilton, don't forget to get your parking ticket stamped at the conference information station here. And speaking of stamps, we're going to put a stamp on the conference with closing comments by the president and CEO of Breeders' Cup Limited. Ladies and gentlemen, please welcome our final speaker, Craig Fravel. All right, Craig, very good. Well, you got that California look going for you.
Hey, I got my Breeders' Cup swag on. So first of all, I always try to follow presentations on laminitis because you can't be upbeat unless you follow laminitis. So fortunately, we're going to be going over the rest of this week to the Breeders' Cup. Tom, I did want to mention to you, Tom, in my view, is one of two sort of iconic announcers in horse racing, at least I've been in this since 1990. And I had the privilege of working here at Del Mar. And Trevor Denman, who you'll hear this afternoon, sounds a little different than Tom because he's from South Africa. I think you'll enjoy hearing Trevor call a race. But as you might gather, since I was the executive vice president here and the president for the last year of my career here at Del Mar, I was here for 21 years, and I would, on many occasions, make some kind of presentation in the winner's circle. And for 21 straight years, Trevor Denman never managed to pronounce my name properly. And I mean, I heard every variation of it, Fravel, Fravel, you name it. And now Tom Durkin is his only shot at it, and he got it right. So Trevor used to be my favorite. Now I guess it's you.
I appreciate that very much, Mr. Fravel.
Yeah, right. My wife pronounces it Fravel because she thinks it sounds more sophisticated. But anyway, so just a little bit about the Breeders' Cup. I don't know how much all of you know, or I hope you know something, but the Breeders' Cup I consider one of the modern miracles in horse racing. In 1982, a guy named John Gaines came up with the idea, actually based upon a harness racing event called the Hambletonian. And Mr. Gaines decided that horse racing needed a year-end championship, that there really was no culminating event that had a television presence that was an important finality for the racing industry. And so in 82, Mr. Gaines came up with the idea. He went to a bunch of breeders in central Kentucky, and he said, I want each of you to come up with $50,000 and put in the seed money to get this started. And there was another gentleman at the time, I think it was John Nehru, who just said when Mr. Gaines made that request, he said, 8 people got up and left the room, and 2 people put up the 50,000, and then we moved forward from there. But the reason I call it one of the minor miracles or major miracles of horse racing is that they announced the intention to do this in 1982, and in 1984, they actually held the first Breeders' Cup up the road at Hollywood Park, a star-studded affair with people like Elizabeth Taylor and Cary Grant. And from the very get-go, it was a huge success. Partnered with NBC Sports in the early years. There was a brief deviation before my career over to ESPN, and back in 2012, the event returned to NBC Sports, which really has since then become the home of thoroughbred racing in the United States. It's a partnership for us that's been incredibly positive. Our friends John Miller and Gary Quinn at NBC know how to put on horse racing and are enthusiastic and really enjoy putting on the event. So starting in 1984, there were 7 races in the Breeders' Cup, $10 million in total purse money. The end of this week, you'll see 13 races. At one point, we got up to 15, but we decided that 2 of those races weren't really of sufficient championship caliber, so we cut back to 13. $28 million in purse money and awards, and another $1.2 million in undercard purse money. As you can see, this will be the first time the event has been held at Del Mar. So I've gotten a million questions this week from the media about how it feels to come home. It's always nice to come home, especially since my wife and daughter moved out of Lexington, Kentucky, and came back here and said we're not dealing with any more winters. So in order for me to see my family, I had to get the Breeders' Cup here to Del Mar. But I think you're going to find as a racing venue and a venue for the Breeders' Cup, it's going to be a very special experience. We did something similar in 2015. We went to Keeneland Racecourse in Lexington, Kentucky for the very first time. And many, many people said that that couldn't be done, that the venue was too small, the town was too small, the people didn't know how to entertain VIP guests from around the world, there weren't good hotels, there weren't enough restaurants. I think that at the end of the day, I had people just thanking us profusely for coming and saying what a wonderful event it had been, and it went off without a hitch. So we're hoping for the same thing here at Del Mar for the first time. There were fewer critics because they were a little more confident in the Southern California environment. And I don't know about you guys, but I've been obsessively checking my weather app on my cell phone for the weather. We had a little drizzle yesterday morning, and I think maybe some more tomorrow morning. But for those of you who can stick around for the Breeders' Cup, I can promise you 2 of the greatest days of horse racing in the world. It really is I've been doing this, as I said, since 1990. Every time I've been to the Breeders' Cup, I have been amazed at the quality of the animals. You'll get to see people like Bob Baffert, Hall of Fame trainer. There's probably 10 Hall of Fame trainers with horses in. I haven't actually counted them up, but and all of you will get be in close proximity to them. Aidan O'Brien from Ireland, who has brought the Ballydoyle contingent of 14 starters. Very exciting, and every time you walk down around the paddock for one of these Breeders' Cup races, you see some of the best horses in the world. And you can see the difference. For those of you who are thinking about getting into the game or have been into it at certain levels, you can see the difference between these horses and the day-to-day variety that you'll see this afternoon. Not that there aren't some great horses this afternoon or some future stars that you might see, but it's nothing like you're going to see on Friday and Saturday. So I want to welcome you to Del Mar. Thank you for coming to this conference. I can't cap it off for you because I actually haven't been here for 1 minute of the conference, so I never heard anything other than laminitis. But it's truly a pleasure to have you here. I really hope you enjoy your time in Del Mar and at the Breeders' Cup, and thank you for coming to this conference. Tom?
And I can assure you, and our attendees, Craig can also assure you that by far and away, most of the moments here were far lighter than discussions of laminitis over the past couple of days. All right, this very important reminder, though. We want to thank our conference hosts, Owner View and the Blood Horse. Without their tireless efforts and dedication and enthusiasm for our thoroughbred athletes and the racing industry, great events like Owner Conference wouldn't be possible. And we want to thank all of our sponsors that have helped make this possible. But more than anything else, we want to thank you, for attending and supporting OwnerView. Hope you've enjoyed it. I certainly have, and thank you very much. All the best.